Middletown Board of Health and Environment to order for March 12, 2024 at 7:32 a.m. And Amanda, would you please do the roll call?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Sipsey? Ms. Miller?
Here.
Ms. Lawley?
Here.
Mr. Bunnell?
Here.
Dr. Zollek?
Here.
Wonderful. Okay, so next on the agenda are citizen comments. Do we have any? I'm sorry.
Excuse Mr. Richmond.
Oh, okay.
Not Mr. Richmond.
Or-
Ms. Sipsey. Looking right at you. And Ruth. Oh, Ruth, and Ruth's here too. So good, okay. So Mrs.
Ms. Sipsey?
Yes.
May I have a motion to excuse Ms. Sipsey this morning?
So moved.
Is there a second?
Second.
Okay, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Here.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Dr. Zollek?
Here.
Perfect. Okay, the motion passes. Ms. Sipsey's excused. All right, so next on the agenda are citizen comments. Do we have any comments this morning? No. Okay. Hearing none, we'll move on. Next item on the agenda is the approval of the minutes from February of 2024. Is there, do I have a motion to approve the minutes?
So moved.
Is there a second?
Second.
Is there any discussion? Okay, it has been properly moved and seconded to accept the minutes as they stand. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Dr. Zollek?
Yes.
Fantastic, wonderful. The motion passes, and the next item on the agenda is to receive and file our financial report for 2024.
I'd like to make a comment regarding this. In your packet, you should see two reports, one saying expenses, one saying revenue. Upper top corner should be for the month. I still have to apologize, finance is not caught up with the complete inputting of the data. So January's here, February is not completed yet. So I'm expecting next month, we should have the full report, but it should be revenue brought in, simple, and expenses going out, and our budget items. Still working through some of the terminology here because they have all these what do you call it, descriptions or titles are put in by finance, and some of the grants we do not have anymore, but we still have money coming in, so they have kind of a fictitious names. For instance, Child and Family Health Service Grant, they have $14,333. We don't have that grant anymore. However, we still have a grant that equals that amount. So we're trying to get some of the terminology. So the numbers are correct, the descriptions are kind of off. So just wanted to bring it to your attention. When we get a full report, I will make sure we take a moment to look at it, and that's how it should be moving forward. Does that make sense? But I think they're almost finished. They said that the auditors will be in the end of this month, so they should have all of the kinks worked out of this new system.
Why does it take so long? I mean, 3 months?
You talking about the new financial
Yeah,
system?
I mean, will they have it by the end of the year?
I wonder if it was partly due because we were down some employees as well. So since basically like one person was doing everything for the entire
That's
city.
good.
So to be continued, but everything is still, we're tracking, really still ahead of the game since it's March.
And I'm not
So we're
sure,
good.
that's an idea, that's a possibility.
Mhm.
Are we also going over the financial notes right now, or just approving the,
Yeah, that's it.
Financial.
That's the whole financial report.
okay. All right, okay, so do you have a motion to receive and file this financial report?
So moved.
And do we have a second?
Second.
Okay, it's been properly moved and seconded. Do we have any discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Mr. Bunnell?
Yes.
Dr. Zollek?
All right, the yeses have it, the motion passes. Next on the agenda is our education presentation for the 2024 total eclipse. Ms. Corbin?
We turn off the lights for the effects.
So, you've been hearing me kind of interject this in the last few meetings that the solar eclipse is coming. We are less than a month away. It is on April 8th, so we wanted to kind of give you why it's important to public health. So what is a solar eclipse? A total solar eclipse. Happens when the moon passes in between the earth and the sun, and it completely blocks out the sun. That photo kind of gives you that perspective of really the small window that is going to be blocked out, considering the moon is so small in comparison. The sky will be darkened, much like it is right now, but it will be 3 o'clock in the afternoon. The last time a total solar eclipse was in Ohio was in 1806. And then, sorry, my vision's a little blurry today. There have only been 15 visible in the U.S. since 1867. The last one was in 2017, and believe it or not, Ohio and this Total Path of Totality has been planning for this event since then, since they knew the predicted pathway. The next time it's going to be visible in the U.S. is 2044, but the next time it's going to be visible to this extent in Ohio is 2444, so definitely not in our lifetime. So this is the projected path of totality. The blue line in the middle is the center point, which is going to have the longest period of darkness. It's going to be coming from the south edge of Ohio, moving north in that direction, and then around 308 is when it's going to start to get dark, like dark. Partial eclipse will be starting roughly in a little after 1 o'clock. You'll start to see those first phases. So if you look down into the highlighted area, they have the time frame for Hamilton. Sorry again, that's too far away from my eyes today. But yeah, right around 308 is when we're expecting to see our totality here in our area. This was just, to me, a good visual, kind of gives you an idea of who's going to be in the darkest regions. And we will be in that 100% totality range, and then the farther south and east we go, the less, they won't get that full blockage of the sun view like we will. So why do we want to plan for this? Because populations within the totality area could double to quadruple, depending on the proximity to the center line. Increase in traffic. People will stop their cars to watch this event, or people who aren't really aware that this event is happening are going to wonder why it got so dark so quick in the middle of the day. There's going to be stress on local infrastructure, including police, fire, just roadways in general. And in certain locations, increased demand on restaurants, stores, hotels, shopping. Because again, if you're bringing in double to 4 times your population, that's that many more resources that people are going to need. So another reason we plan is because it's April. Weather in April is not typically the friendliest. Temperature ranges can be pretty extreme. Rain is a big possibility. Occasionally there's snow, and unfortunately it is the tornado season. That pathway that you see shaded is the history of tornadoes in April. So it kind of follows the exact same path that this eclipse is following. So these are reasons why we plan. Next. So, aside from the the negative side of the worry side, we need to also be prepared to watch this if you're so interested. So if you're viewing, biggest thing is don't directly look at the eclipse. You can use solar eclipse viewing glasses. I bought a pack for our office. They're simple little cardboard glasses with the appropriate ISO certified lenses in them. to protect your eyes. You can find them online. I would highly recommend, though, that you make sure that they are ISO certified. Go directly to the manufacturers. NASA is has a great list of authorized vendors of lenses. That way you know you're not getting knockoffs. But you are seeing them pop up. We were discussing earlier. They're popping up in Walmarts, Cracker Barrel, all over the place. People are trying to get these out there. Or you can go old school. You can go online and get some DIY projects to make your own projector out of the cereal boxes like they used to teach us in school, or something as simple as a colander, like in the picture, where you take a colander, put your back to the sun, take your little pasta colander and have it project a shadow onto the ground or onto the wall, and you can see the little crescent shapes in this picture, if you can see them well enough. You'll see the phases of the eclipse in the little holes of a colander. Do not use your phone to view it. It does not have a protective screen, and it could actually damage your phone. You can view the eclipse directly without proper eye protection only when the moon is completely obscured by the sun. So or other way around, sorry. The sun is obscured by them. So the problem is with that is, when is it not going to be obscured? So I still don't highly recommend staring up, but there is a short amount of time that you can look up and see just that. You'll see a white ring around the moon. Plan accordingly for travel. Make sure your fuel tanks are full, just in case there are traffic backups. Always have emergency equipment and water in your vehicles just in case of breakdowns or you get stuck. Outdoor venues might not have enough shelter if there's bad weather, so make sure that you're aware of the weather coming in, and always be aware of your surroundings. Everybody's going to be looking up at this, so bad actors could take advantage of that. So make sure that you know where all your belongings are, and just in general try to keep your surroundings in mind. So if you have any questions about the eclipse, I'd be happy to answer if I know the answer.
You mentioned that it'll start getting dark around 1:52 in the afternoon.
That's when you'll start to see those first phases, those little crescents going across. Still not that you want to be looking up without eye protection though, but it should start those phases.
Will it take also that long for it to end as well then?
Yes, it's
Couple
expected
hours.
to be, it'll be out. I believe the projected time is around 3:30.
Okay.
It should be done.
And I think DMI is doing some activities downtown as well. Downtown Middletown Inc. is supposed to have Swallows parking lot,
Planning
maybe
for
a
darkness.
band and,
Planning for darkness.
yeah, planning for darkness event, so a band and giving out glasses and,
Oh, something like that.
yeah,
right?
something like that, yeah, so they were supposed to have some activities. The city had talked about, did they wanna do anything, but then they were wondering how closely did they want to make sure that people were safe too, cause if it's not, and so I think they are supporting DMI a bit in their event, but not on the other side of it, like calling for people to come in. Although a lot of places up in the totality longer time are taking advantage of it as far as renting out campgrounds and, you know, and making sure they have, what do you call it, like temporary event?
Yeah, so
food
this
events?
picture here, all those orange dots are planned events in Ohio that have been reported into the EMA. So lots of months going on.
Mhm.
And that doesn't include people who have, decided to just have a big field party next door that's just not, reported. So, yeah, there's a lot of events going on, but primarily along that center line is where you're gonna see the highest population.
They're thinking
And
that-
Butler County schools are closed,
Mhm.
and so, and the reason they closed, some people were wondering, the reason they're closed is transportation happens right at that time. So they were concerned about if it was any, high traffic or disruption in traffic, they didn't want the kids like in that too, so.
for hours waiting.
Correct.
So one of the things that we mentioned was to, in case there are delays in traffic, to go ahead and fuel your tank and make sure you have water in your vehicle. I also heard that it's just a good idea to go ahead and fill up your tank like in the days beforehand, so maybe over the weekend, just in case. We might be expecting, I heard up to 20,000 more people in Middletown that day. So that is something for restaurants. That's a lot. That's a lot of people. So, especially off the highway, it seemed, any of the entrances. But restaurants could prepare. I think we'll have to. I guess. Do you know what our police and fire are, how they're preparing as well?
I personally do not.
Okay.
But yeah, that's kind of that infrastructure, and like I said, like you were saying, the restaurants are you're gonna have longer waits, potentially, store shelves, you could run out of, certain things as well, so definitely preparing ahead is a good idea.
And trying to probably not drive too much at that time because people do pull over. So we'll see a lot of people pulled over on the highways, maybe even just on our local streets as well. People pulled over, maybe even stopping suddenly, so it's something to be aware of. If you don't have to travel, perhaps maybe don't, maybe stay in that day.
And I think the real important thing is a lot of people it may not be anything, right? But in public health, it's always about prevention and you have to prepare. And so, like Chandra was saying, you could have a perfect storm where you have a tornado at the same time when all these people are here. I mean, you just never know. So it's good to be prepared, and we've been planning with EMA through this whole time to make sure, and hopefully we'll get to 5 o'clock on April 8th and everything is fine. But just in case, we would be prepared, to join with other agencies if we needed to. Also, Middletown may not have any problems, but if our neighbors have any problems, they'll call on us for help. And so that's another thing. So hospitals and everybody is alerted to, just in case. Because if you have something going on, accident in Montgomery County, you may have to divert, and hospitals do that all the time. They send people to places that are less active or less impacted by the event. So.
I wanted to mention also, we had mentioned EMA a couple of times, just for people who might be watching
Oh,
online.
I'm sorry. Emergency Management System. So that's all of our emergency people that would go, police, fire, public health, hospitals. They're all part of that system, emergency management system.
Yeah, emergency management agency, and in Butler County, it's just absolutely phenomenal. Like, we have one of the best. We travel nationally, in fact. So I think we're very well set up. Thank you so much for that. Any other discussion? All right, okay. Okay, so that concludes the total eclipse presentation. Next item on the agenda is new business.
Yes, we have a travel authorization for Sarah Cheney. Sarah is one of our environmental health specialists in training, and she is going to Columbus for the conference on April 11th and 12th, it looks like.
And that's a conference on the annual, let's see here, what's it called? Changing Climate of Environmental Health.
Yes. This is every year, correct, Carla?
Annual
Yes.
education.
Annual.
Fantastic. Okay,
And that just needs to be we need a motion for that approval.
okay, wonderful. So, we are looking at approving, do we have a motion to approve the travel request
Yes.
for the Changing Climate of Environmental Health for 2024? For Sarah Cheney?
So moved.
Thank you. Is there a second?
Second.
Wonderful. It's been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. Ms. McDonald?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Cash?
Yes.
Ms. Miller?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Dr. Zollett?
Yes.
Wonderful. The yeses have it, and the motion carries. The next item under new business is the 2024 Public Health Week from April 1st until 7th.
Yes, and we often get a proclamation from you as well for Public Health Week, but it is every year, as you all know, and I was excited looking at this. It pretty much is in complete alignment with Middletown, Destination Middletown, and Middletown Connect, et cetera. It's talking about civic engagement and healthy neighborhoods. So if you look through the packet that you have in there, it's a lot of activity that we're doing that is right in line with Public Health Week. So hopefully we'll start being able to make sure people understand that Destination Middletown with healthy neighborhoods, safe neighborhoods, et cetera, Middletown Connect, it's all the same. It's all the same, making our neighborhoods and our community healthier. So we can start doing efforts and making sure we kind of weave these things so that we're not duplicating our efforts. And we're leveraging our resources, our financial resources. And so, to be continued, but that's it. And we'll get that information down to Amy Skank. Usually, we present it the first week in April at council meeting.
Okay, so.
Sometimes I'm there, and if I'm not there, you kind of present it to yourself.
Okay, so, that'll be April 2nd.
Yes.
Tuesday, April 2nd.
Tuesday,
So
April 2nd.
there will be some kind of presentation.
Yeah.
Or proclamation, or both.
Yeah, both.
Okay.
Yeah.
Okay, great.
Yes,
And
yes,
just
yes.
looking at this packet, for National Public Health Week, it's pretty exciting, lots of,
Mhm.
things that are being recommended. And one of the things that was salient for me is, having SNAP at farmers markets,
Mhm.
available. I don't know if that's something we have done at our farmers market, I'm not sure. Might be nice to see if that's possible when we have our farmers market coming up this summer again.
Right. I do know the farmer's market, when they have it for WIC, they have the interchange where they have the SNAP cards, or the cards
Mm.
where they can get anything in exchange. But we'll check. I think last year, Jerry Lewis was looking at having debit card type things. And most of the cards now for SNAP is like a debit card.
Mhm.
So if you have the ability to swipe a card at your farmer's market, all cards can be swiped that way. So we will double check. But we are excited we're doing a lot more farmer markets. And so that's getting some traction in the community. Not farmer markets, but community gardens. So that's getting some traction, exciting. And then throughout here, when we said speak for health, your voice matters to advocate for health. When we met with Thomas Hall and prevention organizations, Safety Council and Middletown Connect, he had mentioned, Thomas Hall, that maybe we do a health summit every year. And we do it maybe in May. We're looking at the date, maybe the 3rd week of May, because he said the primaries are always, like in March, and you have to get beyond that. But it would be a time that your policymakers, and you were there at that too, remember at that meeting? The policymakers would come together, mayors, township leaders, et cetera, and we would just do a quick snippet on health in Butler County. And so we can kind of tell them what we're seeing, trends that are going up or down. We could talk about tobacco and vaping, because the discussion did come up with one of our political figures really being concerned about being business friendly. And we start talking about we need to make sure that we are being business friendly to friendly businesses that affect our health. And so, to be continued, we'll let you guys know about that, know about the date, and that could be really exciting. We've had people that wanted to help us with this event. If you guys may not know, because you're usually not invited because it's only township trustees, Butler County Health Department has an annual health meeting every year. And it is for all the township people to get together with the health department, and the health department does a big presentation to those people. So that's what Thomas Hall was speaking of, something like that, maybe it was just about health. So, to be continued, we'll get that information out to everyone once it's formulated, but.
That'd be nice, and maybe even to visit that one this year, just to see what they do.
Oh, yeah.
One thing I also, under civic engagement under the packet, I thought it was really interesting. It says that another analysis, the Health and Democracy Index, showed that states with more inclusive voting policies have fewer barriers to voting, have better health outcomes.
Yes.
Just very interesting. So like, there's that, what's that gap, between voting and having people being civically engaged, just better health in general, which does kind of make sense. All right, is there anything else? Do we have to accept, or?
Nope, this is just
Okay.
info.
Okay, fantastic. So that concludes new business. Next on the agenda are reports, and we'll start with our health commissioner.
The other thing I want to speak about is the presentation. Middletown Connect is getting a lot of traction. People speak of it often at different times and opportunities about engaging the community. We're gonna have another presentation to the Board of Health. When I say we, is Safety Council and the Health Department put this grant together. So we are gonna do a presentation, I think Christy or Deanna will come in and do a presentation for the Board of Health. But we're gonna have a big presentation to the community. Again, we had one at Miami University, but we'll do it again as far as the status, where we are and where we're going again. But we've had a lot of people reaching out to us to give us money and for this project. So we have been presented to do opportunity to do a retreat. Come in, ladies. Hey, good morning. So, Interact for Health wants to give us maybe $100,000 a year for 3 years to continue this project, but they want to bring us together for a retreat. Starts Friday night, the 12th, and it goes into all day Saturday to kind of package how we have been engaging the community. And so we don't know how that's gonna turn out, but they keep hearing about philanthropists wanting to tap into what we're doing. And all we're doing is going down to the community level, letting the community have a voice, let them speak, and kind of start introducing them to our politicians, introducing them to the school system, to the police department, et cetera, so they can have a voice, that community civic engagement type thing. And so it's exciting. It's getting easier, believe it or not. When we did Rosa Parks at first, that community, I think some of the city leaders and stuff were it was kind of like that painful, because when you hear people speak about their community, it sounds like they're complaining, right? But they're not, that's their voice, but then after a while, you'll start hearing how much they love their community and how much they love their neighbors, and then how much they wanna help. And so it gets easier and easier. So at first you're kind of like, ouchie, ouchie, your feelings are hurt a little bit, because it comes back on what we're not doing. But then you hear loud and clear how they want to help, and how it's just communication barriers. And so we will be doing a presentation again to you guys. I'll be doing a presentation with our community health assessment and our community health improvement plan and Middletown Connect issues to Safety Council's occupational meeting. So we're gonna get the word out that way. And so to be continued, but when you guys keep hearing Middletown Connect, that's a part of you all, because that was the grant that the health department is in partnership with Safety Council. We also have been selected to do a presentation at the state at the spring conference. And so Christy, Deanna will be coming up. Carrie Yeager, which is with Butler County Health Department, and I will already be at that conference. This is the end of April. But the state wanted to hear about it too, because this was a Ohio Department of Health grant, that Ohio is grant. I'm trying to look at the faces that remember some of that language. So it's exciting because it's kind of all coming together, and hopefully we'll get this big package, but we don't know what that package is yet, because it's really organic. We don't know. It might be how to engage your communities, and it might be a package of that you actually get to keep presenting to other groups. Every agency, and you guys may know this, or every agency, if you're ever trying to get a grant, or if you're ever doing accreditation, or if you ever do, they'll always say, what is the community that you serve? Who is the community that you serve, and how do you engage with them? And so this is one of those things that it just completely, you'll have it a handle. You can say, oh, let's get Middletown Connect there, or let's present to this group, and then you can get your community. So it might be something like that. We don't know, but we're excited because people keep asking us what do they want done. Mayor's been involved in a lot of this. Sally's been involved with a lot of this in the beginning, some of our walk and talks. And so to be continued, it'll be more and more, and it just kind of, I think it goes hand in hand with our community health improvement plan as well. Because when we're trying to improve the health of our community, what does our community say about health? And so you kind of have to go back to that, not just do what we think when we have high rates of suicide. High rates of suicide, we automatically would go to, oh, maybe mental health and depression. It may be something completely else. It could be something else that the community has identified. So I also have started communication, this all bleeds together. I sent out this whole Public Health Week packet to the city managers. You know, we have Paul Lawley, Nathan Cahill, and Ashley Combs, which are the two assistant city managers, the economic development person, Alicia Moreland, and Public Works, Scott Tadish, and communications person. And he's gonna come in one of these meetings immediately, Clayton Castle. And I keep telling them, this is how we all fit together. This is how we work together. I think Mr. Lawley's says better together. I think that's what he always says. And this is one of the ways that we can stop kind of duplicating things and kind of come together with some of the planning that we're doing. So to be continued with that. Also, last but not least, we're excited. Last year, when we did our CHIP, not last year, last assessment, we did our CHIP planning. We said we wanted to start walking groups, and we never really got that kicked off. Now we have 2 walking groups. One Middletown Connect Walk and Talk group, and then another one that's getting ready to spring forward. Walk, what is it called? No, Walk with the Doc. And that's a nationwide program, maybe bringing doctors out of their retirement. But it's a big plan, and it's really cool, but you get together and you get to communities and you get a chance to walk with doctors and talk about your health or whatever, and that's usually done quarterly, those walks, but then you encourage your community to continue to walk and talk, but then doctors come out and have these discussions. Walk with the Doc is a package plan that we would probably partnership with hospice, and I do believe Community Foundation put money towards this initiative. So to be continued, but that's exciting too, because that's another thing that people have spoken about as far as wanting to get better health and better information with their physicians, with talking directly with physicians. So I think that's it. I think that's all that I have. In my packet again, I just, I sent out to you what I usually am kind of doing in general. If you have any questions about any of these meetings, just let me know. But these are some of the things that are going around. Carla can talk about where we are with Tobacco 21, the update when this Carla's report, but I think that's it.
You had mentioned that Middletown Connect will be presenting to us. Do you know what month that will be?
No, we try to work with the, Dr. Geneline between our educational points, and so we will get back with you. We'll let you know as soon as possible, unless you guys have a good month to meet with them, but they'll just put back and forth like an update, back in front of us, an update. So if you guys have a special month, let me know, but otherwise we'll check back and forth. We're trying to put our education moments in between sometimes when we have open spaces, so that we don't burden Dr. Geneline too much. So do you need, do you want a special month, or
I'm
you
just curious.
Okay, just curious?
Just wanted to know, 'cause that'll be good to hear.
Yeah.
And
Where
one of
we
the
are?
one of the things I wanted to mention about Middletown Connect and the last data walk that we had, I think that was Amanda,
Amanda?
on the 29th of February.
Mhm.
And that went really well, talking about that connection with city leaders. We had several city leaders there, and there was like an instant connection with the city manager. He was looking at some of these things that the Amanda district need and said, well, the city can do this, and this, and there was a conversation, I think the next day, with the resident ambassador from Amanda. And so that was just instant, and it was a wonderful thing to notice. And so that's the kind of conversation, those are the kinds of outcomes that we get from Middletown Connect.
Also, and I know you admit it, they were concerned that it was turnover with the city, so as soon as they are heard by city government, then everything changes. And so she said, it's all new people, remember? And so with the mayor being there, city manager being there, and who else was there? Scott was there, and so, and Steve Longworth. And so they could see that, they could voice it again, because often you start conversations and then the players change. And then you feel like, but you have to keep moving forward or whatever, so.
Yeah, that was a part of the conversation actually that we had after the meeting was, because that is what is to be expected anytime. Nothing is ever done. If you stop working for certain rights or certain ideas, they'll kind of fizzle away. So this conversation is just sort of like, you just keep swimming, like in
Mhm.
Finding Nemo, just keep going, little baby steps over time, but that's how that stays alive and in the conversation, that's
Mhm.
how it can change and shift and morph as well. And so that was kind of like that realization, like, yes, there always are going to be new people, and we still have this conversation.
Right, we still have it.
Yeah, so thank you. Any other conversation over the health commissioner's report? Okay, thank you so much. Moving on, we'll go to our medical director.
Reportable illnesses for February, it was a fairly interesting month with, we had 1 TB case, we had 3 syphilis cases, 2 salmonella, 2 pertussis, 9 influenza hospitalization cases, 1 HIV, 2 hepatitis C, 1 hepatitis B, 9 gonorrhea, 1 dengue fever, and 26 chlamydia infections. And Chandra has some information on other things kind of locally. Middletown hasn't seen any measles, but I'm sure everyone's seen measles in the news. It is coming pretty close with 1 in Montgomery and 2 in Miami counties. But to date, nothing for Middletown. And that's all I have to present.
Is there any talk about why measles are on the,
Yeah, they're not getting vaccinated.
is that simply it?
Well, that's a big part of it. I mean, it's a combination of things of, I think there's a introduction of people who've never been vaccinated from areas that have a much higher percentage infection rates, who then are introduced into a community that is not fully vaccinated. And the vaccine itself has a failure rate, depending on the vaccine and things, of 3 to 5%. So you get a certain percentage who get vaccinated but still aren't protected. But then there's a growing, and it has been for a number of years, a growing population of parents who don't get their kids' childhood immunizations anymore. And so you do get a pocket of people who are then susceptible to any disease that comes in from somewhere else, in particular, that they haven't been vaccinated for.
Thank you. Are there any other questions or discussion? All right, hearing none, we will move on. Thank you. To our Director of Nursing.
Okay, so we have seen an increase in our flu hospitalizations, primarily to type A, and for the vast majority, unvaccinated individuals. They're, on average, from what I'm getting reported, they're only in the hospital for a day, maybe 2 days, and then they're discharged home. They just need to get over that immediate hump of, respiratory illness and dehydration from not feeling well. The salmonella, I reported last month that we had the concern for salmonella typhi, and thankfully that did not test out to be typhi. It was a different strain, which is more typical. And the second case that is reported was actually a contact to that person, so household contact. So another good reason to, when you're sick, wash your hands, wash those surfaces, because it is, GI illnesses are so easy to pass on to your household contacts. We did, again, one of the interesting things was a dengue fever. That was in a traveler. So she had been, she said she looked like she had chicken pox because she had so many mosquito bites. Dengue is passed through the bite of a mosquito. So if you are going anywhere tropical, wear some insect repellent, because you don't need to come back with dengue fever and feeling horrible for a couple of weeks. On the preparedness side, again, we are working on the education points for the eclipse. We'll be sending out fax and email reminders to daycares, because schools may be closed, daycares will not be, because parents still have to work. So we want to make sure that the kids are safe during that, so that the daycares can prepare for that. We'll be sending things out to funeral homes. Again, just a reminder that this is happening, because we don't want people getting stuck in traffic for funerals that day if there's a way of planning around either early in the day or postponing. We hate for people to get stuck. Plus, you also have, folks out at a cemetery and then this happens. We want those folks to be safe if they are having funeral services. That is about it. I did just have Dr. Genowine on, because with the measles that public health is kind of getting into a mindset of it's not if, it's when. that we're going to get a case. So I just had Dr. Genowine review and sign off on some standing orders for vaccines. We don't typically do vaccines outside of what we did for COVID and flu unless it's for an outbreak. So we wanna make sure we have all of those potential outbreak vaccine standing orders ready, and on hand in case, because we can get our hands on vaccine relatively quickly. We just can't administer it if we don't have the doctor's okay. So now we have that. But we will keep investigating, we'll keep putting education out for all of our illnesses that go around.
All right, thank you so much. Is there any discussion, questions?
Just something interesting. They're gonna have a pill to treat gonorrhea. Instead of, I think Glaxo has a pill now that you can treat gonorrhea instead of, by injection. Huh?
Instead of injection.
Of course, if, in the old days, when you used to give these injections, it was like, I think 4.8 million units. I mean, that would be enough that you'd never wanna do that again, but.
Deterrent.
It was always kind of a joke.
When you, after that, you couldn't sit down for a week, so that was a deterrent, but I thought that was, I saw.
Over the
that.
counter? Is the pill gonna be over the counter?
I don't know that, I doubt it.
Yeah, not initially. They gotta make their billions first.
But I thought that was interesting.
Yeah.
That is.
Stay tuned.
Well, thank you. All right, any further discussion? Okay, hearing none, we'll move on to our environmental health director report.
We're still in the process of collecting payments for our renewals. I think we have about 40 facilities that haven't paid. So they were due on March 1st. So we've been continually making phone calls and trying to collect those. We received and reviewed 4 sets of plans in February. Another mobile, Kroger remodel, they're remodeling their produce area. Shadox on Central is in a process of remodeling, changing that into a bar.
Next doors.
Part of, I think, both sections. They're
Okay.
gonna keep this front part, but expanding, they're
Okay.
expanding that
Fantastic.
area. And a new La Rosas, which will be on Cincinnati Dayton Road. So we're working with them on those. With the T21, Amanda's in the process of sending information to finance to refund the facilities, the $250. I've been working with the law office to come up with a letter, make sure we have the right verbiage for the letter for the T21 refunds. And Sarah and Brandy will be working this weekend for Spring Blast. That's usually a pretty big event for the weekend, and we'll have a few food vendors out there, so they'll be out there this weekend. And other than just training Brandy and catching up on inspections and starting to inspect swimming pools and schools, everything is on target.
I was gonna say,
Adrian?
yeah, speaking of Brandy, and you guys can stand up and introduce yourself to the board. These are our 2 newest employees.
Hi, I'm Brandy. I'm Stephanie. Sorry.
Brandy is the new environmental health specialist in training, and Stephanie is the new admin. So, and we welcome them both. They make us feel awfully old, but no, I'm just kidding. As you get older, you feel old everywhere you are. They are delightful, and I think it's Brandy's birthday, isn't it? I mean, Stephanie's, right, today?
Yeah.
Yeah, so, yay, happy birthday. So we have cake in there too, if you guys don't want fruit, we have cake there. So, thank you, ladies, for coming in. I know, I told them they didn't have to get here as early as 7:30, but I wanted you to see the rest of the staff.
Well, hello.
Welcome, thank you.
And do you guys wanna go around the room? Jeff, you wanna go around and just say your name and your background, not background, but you know where you're coming from, so they can see what your bullet of health is made of. And then, yeah.
I'm Ruth Lawley. Ruth? Yes. I work, I do outreach for addiction treatment center.
Cash and I'm a retired RN.
Scott Zoll, a retired doctor.
Oh, okay,
And-
right, got it. Elizabeth Slamka, Mayor of Middletown, also the mayor's role here is president of the board.
I'm Joe Richmond, I'm an insurance broker for health, life, and disability.
Okay, and have you met Dr. Genowine? Yeah.
No, I'm Paul Genowine, physician here in town and then medical director for the health department.
Nice to meet everybody.
Thank you, you ladies can be released.
Thank you.
You're good, thank you.
Thank you.
Thanks for
Bye.
coming in. And, Mayor, did you wanna introduce your guest? Because, she's back there shadowing, I think, the mayor.
Certainly.
Miss Ollie.
Ollie, would you like to just say your name and where you're coming from today?
I'm Ollie. I'm a senior at Franklin. I'm job shadowing today because the rest of the school is taking the ACT.
So basically, Ollie has some interest in political science and things like that, so we had the opportunity and said, hey, why not? We're having a board meeting, come see it. Today was the day, right, March 12th, so that's why we're here today, and I'm really looking forward to speaking with her afterwards as well.
Great, nice,
Yeah, thank you for being here.
nice meeting you again. Thank you.
Okay, any other questions or comments? All right, is there anything else before the adjournment? No. Okay, so at 8:18, we call this meeting of the Board of Health to adjourn. And our next meeting for the Board of Health is scheduled for Tuesday, April 9th, 2024 at 7:30 a.m. in this room 2C. Thank you.